There are some treatable causes of dementia. What I mean by that is these are areas that cause dementia symptoms that you listed earlier, but these are areas that can be treated. First thing, medications. Medications interaction or medication side effects. A lot of times our seniors have multiple doctors and multiple specialists. Sometimes they prescribe different medications to treat the same thing. Primary care doctors are prescribing antipsychotic medications. They are not a psychiatrist, but they do prescribe it. And I'm not saying that they shouldn't, because sometimes in some cases, it's okay for them to prescribe it. But if they start seeing a psychiatrist, they're getting all these medications and nobody is checking, right? So it has to be someone to better manage those medications. I recommend always that you have one pharmacy, because you can always contact that pharmacist for them to do a medication reconciliation. That's when they're checking the medications that the person is taking compared to their condition and can make a determination if the medications are fighting against each other. Side effects of medications: dizziness, disorientation, memory lapses. So those are side effects caused by the medication. Thyroid illnesses, diabetes. If those areas are not addressed, then that person looks just like they have dementia. I had my teacher, my third grade teacher, called me probably a few years ago and was very concerned about her mom. Clearly there was something going on cognitively with what she was saying, how she was responding. And I said, "Does your mom have diabetes?" She said, "No, she doesn't have diabetes." I said, "What I want you to do, I want you to have the doctor check her for a urinary tract infection that causes dementia-like symptoms, full-blown. Sometimes they don't know they have a UTI, but you can probably tell because of the behavior changes and the forgetfulness. Dementia should be cause of last resort. You should rule out, and when I say you should work with their doctor or with your doctor on ruling out these treatable causes." I said, "I want the doctor to check her for a urinary tract infection. I want the doctor to check for vitamin deficiency, because if you're deficient in vitamin B12, which promotes healthy blood flow throughout the body and the brain, that can cause memory lapses. And I want the doctor to check her blood sugar levels." She called me back 2 days later and said her blood sugar, she was pre-diabetic. That was something that she never had a problem with. But as we age, our body changes, our processes changes. And so these are treatable things that can be addressed. Substance abuse, what you drink, alcoholic beverages, wine. Now I know wine, red wine has the resveratrol in it. That is a brain enhancing nutrient. However, if you are on a medication with that orange tab that says, "Do not consume alcohol," you can't drink the wine, because it may cause dementia-like symptoms. Depression can be treated. Depression on someone who's over the age of 65 looks just like depression on someone under the age of 65. But tell me if the doctor is going to give them depression medication or even do a depression assessment. The same thing the doctor does for a 15-year-old that has depressive symptoms, I expect that doctor to do the same thing for someone who's 85 years of age, because they're a person living in America dealing with stress that could be depressed. Depression can be treated, but depression looks just like dementia. But there is a depression assessment that the doctor could use. And there's also other things that the doctor could do and use to rule out treatable causes of dementia.